A very good evening. You're watching NewsX. I'm Gauri Dwivedi. Now, a day after Prime Minister Modi announced extension of lockdown till the 3rd of May, now Home Ministry has issued guidelines on the second lockdown. Agricultural activities and selected activities are allowed on after the 20th of April. A complete prohibition stays on schools, colleges, coaching, cinema halls, malls and gymnasiums. Religious gatherings to remain suspended as well. Masks have been made compulsory in the public places, even as the movement has now been strictly prohibited in hotspot areas. The number of COVID cases, meanwhile, total number of cases have risen to 11,439. All right, Dr. Manoj Sharma, who's the MD of Internal Medicine of Medeor Hospital, joins us for a perspective. Dr. Sharma, how do you now see us in the second phase of the lockdown? The full order has now very clearly said that some restrictions will be lifted even as cases continue to rise.
See, the lockdown to begin with was very important and important step which the Indian government had taken and which has helped us in containing the numbers. So, as of now, lockdown should continue, and if at all movement is allowed, it should be selective. So complete lockdown maybe for a longer time in terms of economy may not help, but for health-wise, if we talk in terms of health, so lockdown is very, very good step and it should continue for the time being. Till the cases are rising, lockdown should continue. Once we reach a plateau, probably then we can think of stopping the curves.
And how do you see the restrictions that have been lifted today, some of them?
So like essential activities are all right, but as as general public, I mean, we should also be responsible. It should not be all the responsibility of government. We should be also responsible enough. As we know, as we are aware, this disease it spreads pretty fast. So we have to avoid contact as far as possible. So we as citizens also have to be very actively involved and help government in achieving it. So we must minimize our movement until unless it is dire necessary. We should remain inside homes and maintain strict hand hygiene as well as cough hygiene. You should, all of us should use masks and avoid contacting people as far as possible.
Yes, but you know, sir, now that some factories will be now working on 50% staff, there will be an effort as far as rural India is concerned, agriculture is concerned, SMEs are concerned, that some sort of revival of economic activity will begin. How do you foresee that vis-a-vis the cases that are coming to light right now?
See, if we can have, for the workers, if we have, accommodation from them at the site itself. So, in a way, they are quarantined from the other people. So, they will not be getting, they will not be getting in contact with somebody who is infected. If that is possible, that's very good. If we can have workers residing at factory premises, then and if they are sanitized, the area is sanitized and all the hygienic precautions are taken, then probably those activities can be carried out. But we have to be extremely careful not to spread the disease.
How do you see when, where we draw the fine balance in terms of putting social distancing in place, ensuring that we fight coronavirus, but also have a response to the kind of very unusual stoppage of economic activity that has happened?
See, it's a great problem. Economic problem is there, but at the same time, health is very important. See, if there is flooding of cases, our healthcare is going to collapse. That's what happened in European countries or in US or in, we talk of Spain or, they are well-equipped countries, but the problem was the number of cases was plenty. And it's difficult to handle if all the cases come all together. So it is, the disease is, one is it kills. Another is if the number is plenty, then nobody gets adequate care. So economy is important, but at the same time, we have to remain alive. We have to remain healthy. That's also important. So if we can achieve some activities in which, a sort of quarantine can be measured. The government talked of 50% of workforce. So probably that's a very good idea. 50% of the workers work for 15 days or 2 weeks, and then those go in another shift and another shift comes in and those workers work for 14 days at a stretch, then they stay at home. So that is something which can be done by rotation, probably.
Dr. Sharma, please tell us that do you think kickstarting of the economic activity is actually a good idea right now, given how cases are crossing 11,500?
See, there has to be a fine balance between economy and health. As of now, the number of cases are increasing. So ideally, lockdown should continue. That is one. And if we want to get rid of this lockdown early, then the people have to be compliant. जितना हम सख्ती से इसका पालन करेंगे और करवाएंगे, जितना सख्ती से पालन करेंगे, उतना जल्दी हमें लॉकडाउन से मुक्ति मिल सकती है. ये चीज समझने की है. जितना हम शुरुआत में इन्फोर्स कर लेंगे, अगर हम एक बार प्लेट्यू अचीव कर पाते हैं केसेस का, कि केसेस बढ़ना, केसेस का जो नंबर है उसकी रफ्तार कम हो जाए, तो हम बड़े आराम से लॉकडाउन हटा भी सकते हैं या फेज्ड मैनर में हटा सकते हैं उसको. लेकिन जब तक लॉकडाउन है उसका बहुत सख्ती से पालन होना चाहिए, हमें करना चाहिए और सरकार को भी इन्फोर्स करना चाहिए कि जो लॉकडाउन 2 है उसको हम कितनी मजबूती के साथ और या कितनी सिंसियरिटी के साथ उसे हम लागू कर पाते हैं. ये बड़ा इंपॉर्टेंट है, तभी हम लॉकडाउन जल्दी हटा पाएंगे.
Let's now quickly get in Tapas joining us from West Bengal. Tapas, the one thing that a lot of people have been asking about Bengal is why is there a disconnect between the center and state even in such extraordinary times? And secondly, why is it that many people are discrediting the state government's numbers? Those are very, very serious questions.
The larger problem that we are facing, and in days to come, we really don't know exactly where West Bengal will stand, that most of the hospitals, be it the government hospital, the medical college hospital, the Nil Ratan Sarkar hospital, the RG Kar hospitals, these are all premier medical college and hospitals. Partial portions of these hospitals are getting shut down since last few days. The state government do not have any answer. They say that there is nothing like that. But when you go to those medical colleges, the OPD is shut down. Either the gynecological ward is shut down, or some other department have been shut down. Today, one premier private nursing home, it's one floor, a particular floor have been completely sealed. The menace that we are going through right now, and COVID, and patients who are being taken to these hospitals, which whatever symptoms they have, asymptomatic, but later on when they are testing positive, staying at a general ward or so, not in isolation. So as a precautionary measure, the hospital authorities are completely sealing off a portion of hospitals. Now at this dire time, the main question is, where would the normal patients go? If a person suffers a heart attack, if a person is suffering with a kidney ailment, needs to go for a dialysis, when these premier government hospitals are partially shutting down, then what would happen to common people? Obviously, the COVID is going to be the priority, but what happens to those people who are coming regularly for having dialysis or a fractured hand,
other health issues
they come here in the hospital,
and other serious health issues also need to be addressed, and how they are going to be is really the key question. Thanks, Tapas, for filling us in with all that's happening in Bengal.